Okay. Wait, are there different types of like dengue mosquitoes and stuff like that?
There's really just one type, but there are 4 different strains. It's
Yeah.
really just one type of mosquito, but there are 4 different strains
Like,
that they carry. So here in Manila, we don't even really bother to check what strain it is because if I remember correctly, we don't really have the virus kind of testing, but I think they're bringing it in slowly. And I think maybe might be available already to test for exactly what type of strain infected you, but it's not so specific.
so it's not only in the Philippines that there's dengue.
No, most of the tropical countries will have dengue. And there was even recently in the news, there was even already a case of dengue in the States. I don't think they call it dengue hemorrhagic fever there. I think it's called something else. I think it's called tropical, I can't quite remember, but I know that they already had a case of the same thing that's happening here.
Okay, but could you say like, so the States finally has like dengue, not finally, but like,
Well, I would think that it's probably reached there already.
so
They say that they claim that there's already been a case there. Now, hopefully, it doesn't become endemic there the way it has become endemic here.
yeah, so do you think the place affects the mortality rate of dengue?
I wouldn't say the mortality rate, but I would say the morbidity rate. Usually, okay, these kinds of mosquitoes usually thrive in stagnant water. No, so if you have places anywhere, whether it's in your house, in school, in the place where you reside, or as long as there's stagnant water there, the mosquitoes can just breed in that area.
So when do you think when is the dengue season? When does it occur?
We don't have a dengue season anymore because it's already endemic in the country.
So it's like,
So it's the whole year round. People can have dengue the whole year round.
is there some
More,
reason?
I would say more commonly during the rainy season. Probably not so much during the summer, but we really still have cases even during the summer.
Oh, okay.
Yeah.
What would you say that? Why is it that only the female carries the dengue?
That one I'm not sure about.
Oh, okay. And then, so could you tell us like how you could prevent yourself from getting dengue?
Well, you can actually just make sure that at least the environment where you stay in, at least the place where you can control, like your home, you can actually just make sure that after it pours or it rains, that there are no puddles of water around. And that if you, let's say, try and store water, make sure that it's covered and sealed properly. Of course, it's school. The school should be taking care of that, right? And then apparently the mosquitoes are attracted to dark colored clothing. So you can actually wear light colored clothes during the daytime because they really only bite during the day, not at night. So, and then of course you have your other insect repellents or patches, probably the patches are a little bit safer than you have your citronellas and all of that. Yeah, I think that's probably just although of course the foolproof way is to really just make sure that everything doesn't have stagnant water around. It's just a little difficult to do.
Could you say, so what can you do if you actually get dengue? How can you cure it?
There's no cure for dengue except hydration, which means you just have to keep on hydrating the patient, and then hopefully the patient's immune system kicks up and is the one who is able to help your body overcome the illness. There's really no specific treatment except hydration. I mean, there have been studies where they're trying to test steroids if it has any effect, but you have your pros and your cons, and there are advocates of it. There are people who say it doesn't help at all. Then of course the blood products will help, no? Depending on what needs to be transfused. You can transfuse fresh whole blood if there's active bleeding, platelets if the platelets are going down, some transfuse fresh frozen plasma to increase the antibody levels of the body. But It's really on a case-to-case basis.
So it's pretty much based on the person.
Pretty much based on the case. Yeah,
Oh.
but the general idea is to just hydrate the patient.
Mm-hmm. But would the age, the gender, or like these factors, does it affect the mortality or the health of a
Well,
person?
of course, just like any other illness, extremes of ages will always be affected more compared to the middle-aged groups, right? So you kind of don't want the very, very young or the elderly to catch it because their immune system is a little compromised already.
Mm-hmm. Okay, that's it.